Welcome back to Doc Hobby 2020. Please participate in the polls that appear on top right of your screen. For social message, please go to last 3.5 minutes of the video. Today's topic is nephrolithiasis. Before we go to the topic, let us take a note that we take medicines only after doctor's prescription. Here we have a 40-year-old male who came to emergency with back pain on the right side, traveling anteriorly to groin, and he is restless. He also complained of one episode of vomiting and persisting nausea. Doctor started patient on morphine for pain relief. Patient showed heart rate and blood pressure above normal levels. Hypoactive bowel sounds are heard, which is not unusual in an acute pain episode. No signs of peritonitis like rigidity or tenderness. Genital examination revealed no abnormality. Non-contrast CT detected radioopacity measuring 7 mm in right distal ureter. Soft tissue rim sign strongly suggests stone. Comet tail sign, which is usually found in phlebolith, is absent. KUB can easily differentiate phlebolith and stone. It can also accurately measure stone size, unlike CT, which shows it smaller than its actual size. But can we expose the patient to more radiation? Let us use KUBs in follow-up. What do you think? Comment below. Ratio of peak Hounsfield attenuation level and size is 84, strongly suggesting that stone contains calcium. It also detected mild ureterohydronephrosis and perinephric stranding. Microscopic hematuria is detected on dipstick. Test for nitrates is negative, so let us not burden patient with investigations for urinary tract infection. Microscopic urinalysis confirmed hematuria and also detected crystals of calcium oxalate. Creatinine reflects renal function and it is normal. Hypercalcemia is noted but parathormone levels are normal. Mild leukocytosis is present but it is fine. Stone score is 10, suggesting high risk for ureteric calculi. Patient opted for prevention of stone formation. 24-hour urine analysis was done for the same, which detected hypercalciuria and low urine output. Tamsulosin was prescribed for 2 weeks to cause ureteric smooth muscle relaxation, facilitating easy passage of stone. And you should know, passage of stone is not pain-free. So this is done under cover of narcotic NSAID, which will prevent or reduce the pain. Patient is advised to strain the urine for stone and submit it for analysis. Patient should be followed up after 2 weeks of medical treatment, and if stone persists, surgical options should be explained. He is advised to drink plenty of water. He should be told restricting calcium is not going to help. Instead, ask him to restrict sodium, protein. Tell him to take citrate-rich foods. Coming to social message, shall we drink from today? I mean water. I shall drink 3.5 liters per day like any other man who is expected to drink the same. 2.5 if you are a woman and 3 if you are breastfeeding. Anyway, I don't believe in these accurate measurements. Just make sure to drink enough to live thirst-free life and pee colorless urine. When you have no access to or when you are bored of drinking too much, take a look at these water-rich foods. Cucumber, tomato, spinach, mushrooms, watermelon, broccoli, Brussels sprouts, oranges, apples, blueberries. In modern era full of pesticides, let us not forget to peel the cucumber before eating. I see in market green and red tomato. I suggest you buy red ones. Do not eat them if you have acid reflux, kidney problem, joint pains, headache or urine problems. Don't munch on everything you find near your campsite like wild mushrooms. Boiled spinach is better than raw, and do not eat if you have kidney disease or on medication for diabetes. Watermelon should be limited to 1 veg per serving, and never eat already cut and stored watermelon. Avoid them with alcohol, and if possible do not consume alcohol at all. Do not eat them if you have diabetes or kidney disease. Have an apple with a meal and rinse your mouth immediately after eating because I want your teeth in good condition. I know you don't eat apple seeds, but your child may, so be aware as it is not good for health. Have milk after eating blueberries, if not at least water. Do not eat them if you are on blood thinner medication. Let us peep into calcium-rich diet, which includes cheese, yogurt, milk, sardine, spinach, kale, turnips, collard greens, soybeans, and fortified foods. Do not eat cheese if you have heart disease, high blood pressure, kidney disease, headache, and constipation. Buy yogurt with nutritional label showing less than 15 grams sugar. Sardines are rich in cholesterol. So you may want to limit their intake if you have heart disease, diabetes, hypertension or overweight. Do not eat canned sardines, but if you have no option, choose sardines packed in water instead of oil and look for low sodium content on label before buying. Do not consume them if you have kidney disease or gout. Do not eat kale if you have kidney disease and even collard greens if you are using blood thinner medication. Following conditions mandates the need for doctor's advice on diet, which includes diabetes, hypertension, pregnancy and breastfeeding. Low potassium diet for kidney disease, stable vitamin K diet if you are on blood thinners like warfarin. Dietary advice for individuals with calcium oxalate stones include drinking more fluids, proportionate calcium and oxalate diet, low sodium diet, high citrate diet, moderate protein diet. Avoid foods rich in oxalate like spinach, rhubarb, nuts, bran flakes, potatoes, beets. Do not eat foods rich in sodium like fast foods, sauces, salty foods including pickles, frozen foods, processed meat, canned foods, cheese, buttermilk, and baking mixes. Citrate-rich foods like lime and lemon juice should be consumed. Actually, you can squeeze lime or lemon into your ice cube tray, refrigerate, and then add them into your water to make lemonade. Comment, share, like, and subscribe for future videos. Thank you. Signing off, Doc Hobbit 2020.